is CBS 42 News at 6.
Welcome back. Much of the state now focused on lung cancer today after news that Governor Kay Ivey has been diagnosed with the disease. Dr. Katisha Vance is an oncologist with Alabama Oncology. She joins us now to talk a little bit more about women and lung cancer. Dr. Vance, thanks for joining us.
My pleasure.
I want to start with the concern about women and lung cancer. It is
Sure.
the leading cause of cancer death for women.
It is. And so what's really interesting, Sherry, is that breast cancer and colon cancer are probably much more common than lung cancer, but we know that lung cancer death rates are higher. In fact, in this country this year, there will probably be 150,000 deaths from lung cancer.
We all heard from the governor today about her diagnosis. She said they found a small malignancy and that she's coming in for treatment tomorrow here locally.
Yes.
A small malignancy. Just talk about where we are in treatment today. What are some of the options?
Yes. So in 2019, it is a very exciting time in cancer medicine. And I know that sounds a little bit odd to say. However, we are having newer medicines that have fewer side effects, that are much more effective. And so for patients who are diagnosed with lung cancer, there are way more options today than there ever have been.
So when she says it's outpatient, realistically, it is outpatient, right?
It is, and that is not uncommon for lung cancer. In fact, I think that it would be more unusual to have inpatient treatments. The majority of the patients that we take care of have all of their treatments done as an outpatient, which allows for them to have as normal a life as possible.
Governor Ivey has with us here at CBS 42, and we've done our special reports on the local war on cancer. She's been one of our champions to say that she was joining us in this fight.
Yes.
I think in using her story, how can we elevate it to the point where women in particular get screened? Are there proper screenings for us in lung cancer?
And I hope that if anything comes out of this, Sherry, it will be the emphasis on the importance of screening. And so there is a large trial that looked at over 50,000 patients, and it showed the benefit of doing low-dose CAT scans in those patients so that we can detect lung cancers earlier. Importantly, that study showed that we can reduce lung cancer deaths by as much as 20%.
So who needs to get screened?
Great question. So if you are a smoker and you are between the ages of 55 and 80, you need to talk to your doctor about being screened for lung cancer.
Okay. Dr. Katisha Vance, thank you for talking with us.
Thank you. My pleasure. Glad to be here.
We have much more on Governor Kay Ivey's diagnosis and her plan for treatment going forward on our website at cbs42.com. Jack.